shoulders are a very commonly injured part of the body. It's the most common area of the body I see in clinic. There's many different reasons for shoulder pain. I can't go through them all, but I'm going to go through the most common ones that I see in clinical practice. So the most common one I see is to do with an impingement. So something happening to one of the tendons or the bursa around the top of the shoulder. I also see muscle strains quite frequently, people who have done too much. Then I see frozen shoulder quite a lot. Then I also see labral tears. And lastly, osteoarthritis. So these are the most common causes of shoulder pain that I see. But what we're going to do is go through some anatomy so you can see exactly how the structure of the shoulder relates to your pain. After that, then we're going to have a look at some movements and some tests that you can do at home. And this is going to help you kind of get a really good idea of what it could be. But what I would say is if you have got shoulder pain, always go and get it seen by a professional who could properly diagnose you. It might also be worth having a scan, but we'll touch on that in a little bit later in this video. So right now, let's have a look at the anatomy of the shoulder. So the first thing we need to think about when we're looking at shoulders is the anatomy. Now I get that this is probably not something that you might have a big interest in, but if you know what's going on in the shoulder, then you can relate to how that is with your pain. So I've got two models of shoulders here. We're just going to look at this one here to start with. What we were looking at is both of the shoulders, shoulder blades. So these are the shoulder blades down here. These are your humerus, so your upper arm bones. This is from the front. So as you're looking at me now, if I was to take my body away and just leave my shoulder blades, that's how it would look. So this is the collarbones here at the front. You've got shoulder blades. And then if we swivel it around, this is the back side of the shoulders. So looking at this one here, what we can see is the blue area here. This is cartilage. And if you could just about make out, there's some striations here. This is where the capsule would be. Now the capsule basically holds the joint together. So it seals the joint. So we've got the cartilage of the humerus. Inside, we've got the actual joint of the scapula. Around that, or around this bit that's been cut away, is something called a labrum. You can't really see it on this model, or not that easily anyway. The labrum basically just adds a little bit of extra depth to this joint. So one of the things that can go wrong is this labrum is quite a soft structure. The labrum can become torn. So quite often it can be the upper part at the front or the upper part at the back. This can be known as a slap tear. Then looking above, we've got where the collarbone comes in and meets the shoulder blade. So this is called the acromioclavicular joint. So this is the acromion. This is the clavicle. So the acromioclavicular joint. So the ligaments in here can become strained, or the joint itself can become arthritic. And we'll cover the movements that can diagnose the difference between this or this causing your pain. Then at the front of the shoulder, you might just about be able to see this white line coming down here, this white bit of elastic. This represents your bicep tendon, or one of the bicep tendons. Quite commonly, the bicep tendon can become irritated, although in my experience, it tends not to be the most common area that's affected. So I've mentioned we've got arthritis of the joint, we've got joint problems up here, we've got tendon problem at the front. Then if we add the muscle back in, then I can show you what could go wrong with the muscle. But before I do, what I want you to just pay attention to is this little tunnel through here. This tunnel is quite commonly where we get a lot of impingement. So if we look at this model, what you can see is this green blob. This green blob basically represents something called a bursa. A bursa is a fluid-filled sac, and it allows movement between two structures. So it allows two structures to slide across each other without friction. So a bursa can sometimes become inflamed, and underneath that, which you can't see on this model, is a muscle called supraspinatus. So this red part here is the muscle of the supraspinatus, and then the tendon comes through and attaches onto the top of the shoulder or top of the humerus. So we can get impingement in this area. Now, if you were to lift up your arm like this, that would be like me doing this on the model. So as you can see, or hopefully you can see, you've got this tunnel right here. And as you lift up the arm, this space becomes a lot smaller. So if there's any irritation, if there's any swelling around this area of the tendon or of the bursa, then as you lift up your arm, that can become painful. That will be clinically relevant in the test that we're going to do in a few minutes' time. While I'm at this stage of the shoulder joints, the other thing that can happen in this area, and I've done another video on this, is frozen shoulder. So as I've mentioned, we've got the joint capsule. You can see it is slightly better on this model. So we've got this kind of white striated area here. It goes all the way around to the back, and it actually goes over the top as well. This is called the capsule, and this can become shortened and restricted, leading to something known as frozen shoulder. Okay, so now I've added in some of the muscles back onto the shoulder. Now there's 4 muscles here. This is known as the rotator cuff. So it's 4 muscles of the rotator cuff. Collectively, they add stability to the shoulder. So all of them pull inwards, causing more stability at the shoulder joint. Individually, they have different functions. At the front, we have the subscapularis. This aids in internal rotation. So if you have your hands out in front of you and you take your hands in, that's one of the assisted movements. At the top, we've got the supraspinatus, and as you can see, it's coming through that tunnel and attaching to the top of the shoulder. This aids in abduction of the arm. Then as we come around to the back, we've got the infraspinatus, quite a big muscle, and then the teres minor. Both of these aid in external rotation of the shoulder and also slightly adduction of the shoulder as well. So quite commonly, the rotator cuff can become torn. Muscle strains is quite common, more so with the infraspinatus or the teres minor. Underneath that is where the teres major would attach, but that's not part of the rotator cuff. Then the supraspinatus, so this muscle at the top, this is one of the more commonly irritated parts of the shoulder. So again, impingement of the shoulder is either to do with the supraspinatus or the bursa, as I showed you earlier. Now that's quite common. So impingement, bursitis or supraspinatus tendinitis. We'll go through the test in a minute so you can diagnose, or so you can get an idea of whether there is an impingement. One other thing that I didn't mention earlier as a common cause of pain is calcification of the tendon, so calcific tendinitis. So quite often this tendon, so where it's red, this area around here is probably going to be white. This tendon can become calcified or can have calcified deposits within it. That alone can cause impingement. Also, where we've got this acromion here, we can have variations in the angle of this acromion. So right now you can see it posteriorly sloping, so backward sloping. Sometimes it can be flatter, and sometimes it can also slope more towards the outside. Sometimes, in rarer occasions, it can be slightly anteriorly sloping. So depending on the slope of the acromion, that can cause impingement or predispose you to more impingement as well. So that's some of the common issues with the shoulder. Let's now have a look at some movements and some special tests that might be able to help you diagnose or get an indication of whether it's an impingement, a labrum, frozen shoulder, acromioclavicular joint, and so on. So the first thing we want to look at when assessing shoulder pain is what is the range of motion like compared to the good side. So if you're at home, I want you to try this right now. So stand up, lift your arms all the way up into full flexion. Can both sides move equally? Can you get your arms up close to your ear? If you can do that one side but the other is in front, then that shows some major difference between both sides. Then go into full abduction. So taking your arms out to the side, all the way up to the ceiling and back down. Note where you feel pain. So this is known as a painful arc. This is a test I do. So again, let's assume we've got pain in the left shoulder. Usually, if there is a impingement, we would expect pain to start from around, 40 degrees to about 120 degrees. So this is where the arm is at its most compressed within that tunnel. Do you remember that tunnel I showed you? So the arm is that tunnel is most compressed around this region here. So anyone with an impingement will usually feel pain somewhere in this range here. But once they've gone past this range and come up to full abduction, usually that pain eases off. So that's a really good indication that that's probably some kind of impingement within the shoulder. If, however, while coming up, there's no pain until they get to about 120, 140 degrees, and then there's pain at the top, sometimes that can suggest that there's some kind of compression or joint problem within the acromioclavicular joint, because that's compressing that joint together. But in my observation also, up here, especially if someone's tight in the lower muscles, you can get pain, but it's actually not a problem. So what's happening is these muscles are working so hard to get you into this position that they're just contracting too hard and causing some pain. But actually the cause is the tightness in the shoulder lower down. So it's stopping you from coming higher than this. So then these muscles are working extra hard to pull you up here. From there, we then have a look at what's called the scratch test. So what you're going to do is bring one hand, so start with the good hand, bring that behind you, up your back as far as you can go. Make a note of how far that goes, or take a picture and bring that down. Then do the same on the other side and see how far you can go the other side. In a previous video I noticed that one side was significantly lower than the other. So the arm that goes lower, or that can't go up as high, is often indicating a lot of tightness around the front of the shoulder. So this is ideally what you're looking for, this kind of range. But quite often people struggle to get higher than this, or anywhere around here. Or people start trying to move their shoulder, hitch their shoulder back and sort of wriggle it up to get into position. So that suggests that there's a lot of tightness in the shoulder, particularly with rotation. Now, if you've got a frozen shoulder, you probably won't be able to even get your arm or your hand up above your buttocks. So that is when I suspect frozen shoulder. If it goes higher than buttocks, generally speaking, I'm not considering frozen shoulder. Now, of course, you can also do in external rotation. I don't find this one quite so informative. It doesn't really rule in or rule out much. People with frozen shoulder often are very limited in the range of movement they have in external rotation, but most other shoulder issues are not really aggravated by external rotation movements. So for me personally, I don't find them that informative, although looking at left to right, if one side goes completely out and the other side only moves slightly, then that does show obviously there's restriction and that needs to be worked on. If we're looking at the supraspinatus or impingement or bursitis, or even calcific tendonitis, again, pain in this kind of region would often cause pain. If someone has pain as they're going up into full abduction, what I'll often then do is follow that on with what's called the empty can test. So you bring your arm up into about 90 degrees, take it slightly forwards, then turn your thumb down. If that causes pain, that's known as a positive test. If that does cause pain, then you perhaps don't need to go on to the next step. But what I would often then do is apply some pressure down onto this arm and get the person to resist. If that causes pain, then that's a positive test for the empty can, or active resisted empty can. So that would often indicate to me a supraspinatus tendonitis, a bursitis, and occasionally some kind of calcific tendonitis. Now, a question I frequently get asked is, should I go and get my shoulder scanned? The advice that I generally give is try treatment first, or try stretching, try moving, try and get the pain down. If what you do works, and if what you do is helping to reduce the pain and improve your shoulder, then there's probably not much of an urgent need to do so. However, if what you're doing seems to be making your shoulder problem worse, or it's not getting any better, then I would suggest it's probably worth having a scan just to rule in or rule out certain problems like tendonitis, tendon tears, calcification, the joint problems themselves. So a scan can be quite useful if problems are getting worse or no better. Then go and get your shoulder scanned. If you have just injured your shoulder, there's a good chance you are in acute pain. So acute pain is when the pain is really significantly high, say a 6, 7, 8 out of 10 for pain. This stage is what I would apply phase 1 to. So if you've never heard me talk about the phase 1, phase 2, phase 3, essentially what it is phase 1 is all about reducing pain and inflammation. Once you've done that, the next phase is often to go into improving your flexibility and mobility. Lastly, once you've gone through that phase, the next phase is to re-strengthen your shoulder, strengthen and stabilize your areas or your joints. If you want to know more about these 3 phases, I've got a free ebook which goes into much more detail about all of this. So all you need to do is click on the link in the description below to get your free copy of my ebook. So if you are in phase 1, first thing you've got to do is just get the pain down. You've just got to move. Move your shoulder as often as you can. Now, if bringing your shoulder up to about here causes you pain, then all of your movements that you do should be less than that. So we can possibly go to here. So here's causing you pain. Here is not causing you pain. So what I would suggest is you moving your shoulder throughout the day into this kind of range where you're not in pain. Then you can also apply cold, you can take anti-inflammatories, always speak to your pharmacist or your doctor about medications, and then just wait for the pain to start going down. That's all you can really do in phase 1. As your pain starts to come down, we're starting to move in towards phase 2. Phase 2 is about restoring the flexibility, mobility. So this is the phase where we start stretching. This possibly could take weeks or months. So it's all of these phases you've got to be patient, you've got to be consistent with. So phase 2 is about restoring your flexibility and mobility. Once you have noticed an improvement in your flexibility, then we start strengthening, and that's phase 3. So rebuilding your strength and stability. Now this phase is perhaps, in my opinion, the most important because most of my patients tend to avoid strengthening. When they start feeling better, they think that the problem is gone. But actually, unless you strengthen, the shoulder is just not going to be stable and it's not going to be strong. So the problem can still come back. So it's really important that you do focus on strengthening. If you have just come out of shoulder pain or you're starting to improve your flexibility and mobility, then we're going to go through 5 very simple movements and stretches to help you start getting your shoulder back into recovery. Now, at the moment, if you have just come out of phase 1 and you're moving into phase 2, we're going to keep it very simple, very light. We don't want to start aggravating your shoulder and putting you back into phase 1. You don't want to have any more pain. So assuming that your pain has come down to about a 4 out of 10, we're going to start reintroducing movements and general stretches through the shoulder. So we're going to start by just working on posture. Better posture means better position for your shoulder. So we're going to start trying to correct your shoulder position and your overall posture. And then we're going to go through some very simple stretches that your shoulder probably is the tightest in. So without further ado, let's go into the first exercise. So the first thing we need to consider is, what is your spinal posture like? Now, if you are quite kyphotic, in other words, if you're quite rounded in your upper back, then straight away your shoulder is going to come forward. And look what happens if you're trying to reach up into full flexion. So if you're quite rounded through the back, I want you to try this, probably on your good arm only, is try lifting your arm up as high as you can go. Now see where I'm at here. Now in my head, I might want to try and reach more and more and more. But what's going to happen is I'm only going to cause more pain. So that's maybe one of the reasons why you had shoulder pain to begin with, perhaps. So If you're quite kyphotic, then you can only go to about here. But if you then had better spinal alignment, then straight away your arm becomes more vertical. That's just because the shoulder sits in a better position. Pay attention to what also happens. So if I'm here, I can only lift my arm kind of up more, only a tiny bit. But as I become more into a good posture, straight away I feel like my shoulder has a lot more freedom. So we're going to work on trying to improve your thoracic extension. So we're going to try and reduce some of this hyperkyphosis. And what we're going to do for that is we're going to start using a foam roller. So if you haven't got one, it's not essential. You can just skip to the next stretch. But if you can get hold of one, then grab yourself a foam roller.
Lie on top of a roller with the roller aligned across your back. Start with the roller at the level of your shoulder blades. Place your hands behind your head to support your neck, and then arch over the roller to get extension through your spine. Hold this position for a few seconds and then flex back up again. You can repeat this multiple times per level until you feel a bit looser in that area. Then roll up over the roller a bit further to target a new segment. Repeat this process until you get down to your lower thoracic levels. If you go too far, it can become a bit painful, so just stop before that point. This should take between 1 to 3 minutes in total.
So now that we've worked on our thoracic extension for a few minutes, the next thing we're going to start to do is work on the scapulothoracic movement. And what that means is the movement of the shoulder blade in relation to your rib cage. So the shoulder blade sits on top of your rib cage and slides around it. So we're going to start working on that. So all you need to do for this is stand up nice and tall, squeeze your glutes, tighten up your abs so you've got a nice stable base. Let your arms hang down and relax your shoulders down. From here, I want you to lift your shoulders as much as they'll go. From here, pull your shoulders back, squeeze your shoulder blades together at the back, keep them squeezed together and then drop them down. Once you go down as low as you can, keeping your shoulder blades squeezed, then push your shoulders forwards as much as you can. From here, keep them forwards and raise them up. Keep them up and pull them back. So think of it like a square. You're coming up, back, down, and forwards. I want you to do 10, so you're coming up, backwards, down, forwards. Once you've done 10, if you want to, then you can do that in the reverse order. So at the bottom, this time you're coming back, then up, then forwards, and then down. Back, up, forwards, and down. And so you could do another 10 of them. Of course, if any of this causes you pain, then just stop. Or if you find that 10 is too many, then just drop that down. Drop that down to about 5, 6, 7. Over time, this will get better. You'll start noticing your shoulder muscles becoming a bit stronger naturally, even though we're still in phase 2. And you'll also notice that maybe the range that you can get your shoulders into is starting to improve. So I would do 10 one way, 10 the other. That would be one set. We'll call that one set. That's all you need to do for now. Then I would do this maybe 3 to 4 times per week only. Try and give yourself a day in between rest so your shoulder muscles get a chance to recover. So this isn't working directly on the shoulder, but this will start helping your shoulders or shoulder blades to unlock and get better movement. So the next thing we're going to do is start breaking down some of the tightness within the rotator cuff muscles at the back. I love using lacrosse balls for this. It doesn't have to be a lacrosse ball. It could be a tennis ball. It could be a baseball, cricket ball, laundry ball. Doesn't matter. Personally, I love these because they are rubbery and they grip to the wall very nicely, so it's not going to slip. I'm going to show you a hack for this in a minute. So if you can't get your arm into the right position or you find it difficult to keep the ball where it is, then I'm going to show you an easy solution to that. So what you're going to do is grab your lacrosse ball. This is the shoulder we want to work. So let's say I'm working the left. Hold the lacrosse ball in your right, take it underneath your arm. Now with the bad arm, you grab the elbow and pull this shoulder, this hand around to the back. So place it into your rotator cuff or the back of your shoulder, come up to a wall and press in, so lean in. From here, relax your arms down and move around until you can find a point or a position, part of the muscle that is painful or tender. So let's say I found one here, I'm going to press it in and hold. So the reason why you hold is so you stop stimulating pain. So right now my body is telling me that there's pain and I keep stimulating pain if I keep moving around. So find a position that's tender, press and hold. Hold for 20 seconds. You can build this up over time, build up to 60 seconds over time. You might find that the pain starts to come down, which is great. If it doesn't, just keep holding, just keep breathing. Once you've held for 20 to 60 seconds, then move to another point. Now at the start, you might find you're doing a lot of moving around, trying to find positions or points that are tender. Over time, you'll get an idea of where to go. So then you'll be quicker and more efficient at doing this. So press in to another point, hold, and just relax and just keep breathing. So keep working all the way around the back of the shoulder blade, trying to find all these different points. Of course, you can work any other muscles. So you can work into the muscles in your back, top of your shoulder, and so on. But if you can't get the ball into this position, then here is a very simple hack. So what I would suggest is get yourself a sock. I haven't got a sock, but I can show you what I mean using a towel. So I'm just going to put the ball in the towel and I'm just crudely hooking this up. So I'm just going to use an elastic band just to keep the ball in the towel. So if this was a sock, you just put the ball in the sock and then hold the end. From here, what you can do is just hang it behind you and just position it this way. So then you don't have to worry about the ball slipping out and falling onto the floor and having to pick it up each time. So you just position the ball in the right place and then do the same thing. And then when you need to readjust, you just use the towel or the sock. So the next thing we're going to do is a shoulder extension stretch. Now, a lot of my patients are very tight in the front of their shoulder. So we're going to work on trying to improve this. Now, what you're going to need ideally is a resistance band. This is a purple one. I couldn't tell you what the resistance of this is, but generally nowadays you can get yourself a set where they come in all different resistances and different colors. So that's what I would recommend. I'll put a link in the description below if I can find one. But you're going to get one of these and ideally you need somewhere to hook it up. If you don't have access to anywhere that you can hook it up, don't worry, because I'm going to show you two other variations that you can do. So one you could do on a shelf or a countertop at home, and the other one you can do on a chair as well. So there'll be something for you if you can't use a resistance band. So once you've got the band hooked up, what you're going to do is put your hand through the band, take your hand behind you, and as you do that, lean forward. This is just going to keep the tension off your shoulder. From there, keep your arm straight, palm is facing up into the air, step forward slightly, and as you step forward, try and lift yourself, try and stand up straight, almost like you're trying to lean back. Now, if you find that that's not quite stretching your shoulder, what you can do is then turn away. So it's taking your hand slightly behind your back. Again, keeping your arm straight. As you do that, you might feel it a lot more. So this can come on quite quickly, so just take it easy, don't overdo it, don't go too quickly. If you find it's causing you pain, then just stop or ease up. I would suggest starting with 20 seconds and gradually building up to about 60 seconds over time.
If you don't have anywhere to use a band, you can use any solid surface such as a shelf or kitchen countertop. Turn away from the surface, lean forwards and place your hand on the counter with your palm facing upwards. Gradually stand up straight until you feel the stretch in the front of your shoulder. You can twist away to make the stretch more intense. Then when you're ready to come out, just reverse the process. Likewise, if all you have is a chair, you can do the same thing using the backrest for your arm to stretch against. You just start by leaning forwards, placing your wrist on the backrest and sitting up straight to get the stretch. Hold for as long as needed, up to about 60 seconds. Then when you're ready to come out, just lean forwards to take the stretch away from the shoulder and then drop your arm off.
So the last stretch we're going to do in this series is hanging from a bar. Now the reason this is good is because it causes distraction through the joint. So it causes traction, opens the joint out. Now, if you don't have access to any way you can hang from like a bar at a gym, you could hang from a door frame. Just be careful of how sturdy the door frame is. You could do it 2 hands, or you could do it with 1. Grab hold of a bar, keep your feet on the floor if you can, and then just bend your knees and allow your body to take the weight into the arms, and just keep it fairly light to start with. And over time, as you get more and more used to it, then you can just add more weight through your body. If you want to do 1 arm at a time, that just allows you to change position a bit more and try different stretches while you go through this. But essentially you're going to stretch for, or hang for 20 seconds to start with. You'll be limited by your grip on this one. So it doesn't matter if you can only do 10 seconds. Of course, your feet are on the floor, so you can take some of that weight off through the hand. But as you get stronger and stronger, you can hang for longer. But I would start with 20 seconds and gradually build up over time. If you have some sort of AC joint dysfunction, like arthritis through the joint of the acromioclavicular joint, you might find that being up in this position causes you some discomfort. So if it does cause you any discomfort or any pain, then just stop. Just reduce the resistance, just reduce the weight going through your shoulder. If it doesn't feel right, just don't do it. But again, I would do 20 seconds, build it up to 60 seconds. You could do this 3 to 4 times per week, because remember, the recovery in between each stretch session is just as important as the actual stretching itself. And you don't want to start making things worse. That is the first step in phase 2 to getting your shoulder better, more flexible, more mobile. If this causes you any pain, then just stop. I would suggest you do this 3 to 4 times per week and only do this once per day. If you're going to do it too much, then you might find that your shoulder becomes more and more irritated. If you do find that your shoulder is becoming irritated, then just ease off. Just take an extra day in between, or just reduce the frequency or the intensity or the duration of your stretches. If you're not sure what I'm talking about when it comes to the phase 1, phase 2, phase 3, I have my free ebook, which will go into much more detail. The link for that is in the description below. Now, I would suggest you do the stretches from this video for about 4 weeks. The next stretch that I'm going to show you is really to help you bring your shoulder back. Now, many of us, maybe yourself included, are very tight with the fronts of our bodies. So our shoulders tend to be quite rounded, mainly because a lot of us are working at computers or driving. So those 2 activities really put our shoulders in this rounded position. So this is going to help to pull your shoulders back. It works the front of your shoulder, maybe a bit of your pec as well, but I actually feel it more around the side here. There's a muscle called the serratus anterior, and what that does is it attaches to the inside border of your shoulder blade, and it helps to bring your shoulder blade forwards. So that muscle is probably very tight. So what you're going to do is put your hand on your lower back with your fingers pointing down, like so. Then you're going to come up to a surface like a wall or a door frame and push yourself across and try and twist away from the shoulder that you're stretching. So you're trying to bring your elbow behind your body as much as you can. So I would hold this for about 20 seconds and build it up to about a minute. So the next video we're going to do is for the infraspinatus, which is a muscle that's at the back of your shoulder, in your part of your rotator cuff. But this muscle basically externally rotates your shoulder. So in order for us to stretch it, we need to internally rotate the shoulder. Now this stretch is very similar in appearance to the one we've just done, but it's totally the opposite movement. So what you're going to do is place the back of your hand against your lower back. The last one we did was palm facing your lower back with your fingers down. This time the fingers are pointing across the back. So what you're going to do is come up against a door frame and place the back of your arm against the door frame. From here, push yourself back and then rotate yourself around in the same direction as the elbow. This time you're trying to bring the elbow around to the front of your body. So your arm is coming around the front, and you should feel that at the back of your shoulder, possibly into the side of your shoulder just here. Now this can be quite an uncomfortable stretch, so it'll take you a while to get used to, but to start with, just start with 20 seconds, and as you get more familiar with it over time, then build it up to a minute. Now last but very much not least is a muscle called the levator scapula. It attaches to the top corner of your shoulder blade and goes all the way up into your neck. Many of my patients are tight in this muscle, and this is a really good stretch to get that muscle. So what you're going to do is bring your arm up, much like you're trying to do a tricep stretch. I like to use a wall because I can push against it, so I can get my elbow further back. So come up against the wall, press your elbow or the back of your arm into the wall and push yourself forward. Now from this point you might already feel a stretch. You should be feeling it at the sort of base of your neck, like just in that corner there. So press your arm up into the wall, and then from here rotate your head away from the arm that you're stretching. And you should feel that just in here, maybe up into your neck, and maybe down to about here as well. So anywhere from here all the way up to the base of your skull. So now we've seen those 4 shoulder stretches that you may not have seen before. Let me know in the comment section below which one you found the most beneficial. If you are just starting with these stretches, just don't push yourself too much into pain. If you are experiencing shoulder pain, then just be careful as you do these stretches. I would suggest you start with 20 seconds and build it up over time to about a minute. And in terms of frequency, I would do every other day, because if you're doing these stretches every day, then you might just find you get a bit sore in your shoulders and you're not having enough time to recover. Today we're talking about strengthening your shoulder if you have a shoulder injury or if you're in pain in your shoulder. I would suggest you shouldn't really start to strengthen your shoulder until you're largely out of pain. Now, there are many reasons for shoulder pain, and it's worth getting a professional diagnosis before you try any of these exercises. But essentially, any of these exercises you do, the key is to not push it too far into pain. You don't want to be making your shoulder worse. The exercises I'm giving you today are based on my experience of the most common shoulder injuries, such as inflammation of the tendon, compression through that tunnel where the supraspinatus runs, so we're talking about bursitis or tendonitis, rotator cuff injuries, or joint instability. Right, so every shoulder injury has a range of motion that you can go into without feeling pain. For example, if you had a inflammation of your supraspinatus tendon or bursitis around here, then you will have pain between here and here. So any exercises you're doing, you don't want to be pushing your shoulder into that range. And likewise, you'll probably be feeling pain if you're doing something like a shoulder press. Whereas if you had something like a biceps tendonitis, that would probably be okay. Whereas lifting your arm forwards would probably hurt. So the first thing you need to do is to figure out what ranges of motion you can do without experiencing pain. Most injuries anywhere in the body usually has a lack of stability. So when doing shoulder rehabilitation, the first phase of that strengthening is to regain the stability in the shoulder. So the exercises that I'm about to show you are not necessarily specific for the shoulder, but what they will do is to train your shoulder to engage those stabilizers, those rotator cuff muscles and deltoid pecs, to stabilize that shoulder so you get that control. From there, we're going to go into training exercises that work around the shoulder. So we're not talking about necessarily shoulder press or lateral raises. We're going to be talking about maybe strengthening some pecs, strengthening some rotator cuff, some latissimus dorsi, bit of deltoid, and then we'll go into more specific shoulder exercises. So first things first is to start building that stability in your shoulder. Now all of these exercises can be done with bands at home. Personally though, I prefer dumbbells or cables because the resistance is the same all throughout the range of motion, whereas with the bands, it gets more difficult the more the band is stretched. So you're changing the way the muscle's having to work. Anyway, tricep extension is a great one to start with because the shoulder is in a neutral position. So grab your ropes or grab your bands, bring your elbows into your sides, and from here, pull down, straighten out your elbows, and bring it back up. Now, the reason I like this is because as you're doing this, you're having to force your shoulder into this position. If you can maintain that stability, then you're not lifting your elbows forwards and backwards. You're not having to jerk the weights down. So you're building strength without putting your shoulder into any ranges that the shoulder doesn't like. So tricep extension, down, slow on the way back up. So that's your tricep extension for building stability through your shoulder. I would do about 10 repetitions, rest, and repeat another 2 times. So 3 sets in total. Now I've also set up a band just to show you that you can do the same thing with the band. Hook the band up onto something like a banisters or a stairs, or if you get access to a gym, then on a bar. Doesn't matter what you hook it onto as long as it's strong enough to have you pulling on it. Grab the band, again pull your elbows down to your sides, and straighten your elbows. Now it's going to get harder at the bottom, so you have to engage the shoulders a little bit more and then control it back up. So again, 10 reps, 3 sets. Next exercise for the stability will be a bicep curl. Again, same as with the tricep extensions, I like this because it forces you to bring your elbow into your side and engage the stability in your shoulder. So choose a weight that's fairly easy. You don't want to be doing too much, especially at the start. Bring your elbow into your side and bring the dumbbell up towards your shoulder. Pause and then lower it slowly back down. When you get to the bottom, straight back up, pause and down. You can bring your other hand onto your arm just to make sure that that arm is pulled into your side. Up, pause and down. What you'll often see in gyms, and this is one of the reasons why people get injured, is because the weight is too heavy, and as they get fatigued, they will start to swing the dumbbell up. So you're disengaging the bicep and using other muscles to swing. So you're cheating, you're not using the muscle that you want to use. So you end up putting a lot more force through the joint, and inevitably you're going to cause injury. So again, 10 repetitions. Start on the weak side. You can obviously do the good side, but start on the weak side first so that you know that whatever this arm can do, the weak arm, the strong arm is going to be able to do as well. Do the same number of reps on the strong arm as you can do on the weak arm. So 10 repetitions and 3 sets, nice and slow. Now we're going to get more into the actual exercises themselves. As I said earlier, this will really depend on what you can actually do with your shoulder. If you can't do any of these ranges of motion, don't do them. Wait until the pain goes and then retry them at a later date. But there's no point in you forcing yourself to do an exercise only to find out that it's going to make it worse. So let's assume that you can go into this range here without pain. And let's just assume that you can go up here and that will cause you pain. So you don't want to be working into the range of pain. You want to be working into a range that isn't causing you pain. So I can go from here to here with no pain. So we're going to strengthen that range first. So I've got a cable here. I've set it fairly high so that the direction of pull is going across. Now, in a normal lateral raise, the hardest part of the range of motion will be up here because the gravity is pulling down. So we're not working this part of the muscle, this range of the muscle. What we want to be working is this range. So we need the direction of force going across. So I'm going to grab the handle take my arm across my body, because in theory this isn't causing me pain right now, and then from here I'm going to come out to about here where I'm still not having pain, but if I was to go further there would be pain. So from here across, pause, and slowly back in. Again, out, pause, in. Everything wants to be under control. It wants to have a slow tempo, and you want to be feeling the muscle working. What you don't want to be doing is jerking it, so it has to be slow and controlled. So out, pause, and in. And you can do the same thing with a band. You could just wrap it around a chair leg or door handle and do the same thing. Obviously it's going to get more hard as it goes out, and it's going to get easier as it comes in. And obviously the more you step out to the side, the harder it's going to get as well. So you can adjust the resistance based on where you stand. So again, out, pause, and control it back in. So this is starting to strengthen the outer part, the middle part of this deltoid muscle. The next one we're going to do is to work the front of your shoulder. So again, same thing, you could use a band. And let's just assume that this range here is okay, but if you start to go higher, that would cause you pain. So you want to work that range that's pain-free. So grab your band, start with your arms slightly behind you, and pull forwards, pause, and back out. And again, same thing can be done with a cable. I would probably not do it with a handle on this one. Grab the cable by itself and just pull forwards, pause, and back in. Exactly the same thing. Go into a range that is pain-free. Don't push it into a range that's going to cause you pain. So we've worked the middle part of the shoulder, we've worked the front part of the shoulder. Now we want to start working through the back. One of the biggest muscles around the shoulder is the latissimus dorsi. That's that kind of wing muscle that you can often see on bigger people. So we want to start to strengthen that, because that's going to help to pull the shoulders back. If that's not stable and that's weak, and this is all too strong at the front, then that's going to be putting your shoulder into a bad position. So that could have been one of the predisposing factors for your shoulder pain, perhaps. So you're going to grab a cable, much like you did with the triceps, pull yourself back, lean forward slightly, chest up. Now from here, keep your arms straight and pull the cable down, touch your thighs, pause, and then come back up. Again, you're not taking it too high up, you're not taking it into pain. You're working into a pain-free range of motion, really. So here, pull down, pause, and come up. Again, one thing you don't want to be doing is jerking. You don't want to be pulling down too hard, and you want to keep the rest of your body absolutely still. So you don't want to be doing any of this or this. So none of this. Everything stays still. The only thing working is the shoulder joint. And again, you could do the same thing with the band. Set the band up high, grab the band and pull. Like I said earlier though, with a band, it obviously gets harder as it gets further into that stretch position. So choose a band that's right for you. Okay, so what about the back of the shoulder, the back of the deltoid, the rotator cuff? The next exercise, again, you can do at home with a dumbbell, you could do it at the gym, or I'll show you afterwards with a band. So this is a single arm row. There's two ways you can do it. The first is quite a neutral position, so you're going to set yourself up onto a bench or a bed at home, anything that you can kneel on. Have one leg out for support, grab your dumbbell, chest up, back straight, and pull the dumbbell up, keeping your elbow into your side, pause, and slowly back down. If that feels okay and you want to more specifically target the rotator cuff, you can turn your hand and bring your elbow out wider like this. But again, that depends on whether your shoulder can handle being in that position. If it can't, don't go into it. Keep your elbow in a fairly neutral position. It should be okay down here. All of this is strengthening the muscles around the shoulder. I'll show you now the exercise, the same thing with the band. And then after that, I'll talk a little bit about rotator cuff specific exercises. The other way you could do it, obviously, is with a band at home. So put the band up around sort of shoulder height, chest height, and grab the band. Start here, pull your elbow back, pause, and forwards. If that range up here causes you pain, don't go into that range. Bring your elbow lower and have a more neutral position, even pulling back like this. That kind of goes into the similar sort of action as the last exercise we did, the rope pull down. So have a little play around with this one. Here, pull your elbow out wide, pause, and forward with control. Now, you may have noticed that I haven't so far talked about these rotator cuff exercises. You know, the ones where you get the band and you're doing this external rotation, and then you're doing this, and you're doing coming in. Personally, and this is just my opinion, I don't think they're very good. I don't think they are as effective as they're made out to be. I feel like most of the time they're done with bands. So first of all, let's say you're doing an external rotation. Most of the time from here to here, there's not that much resistance. Then you get to here, and it's actually the hardest part of the movement anyway, and you're now under more stretch, so more resistance. So the resistance is variable throughout that range. It's not necessarily teaching that stability in your shoulder. That's why I've gone into more sort of traditional bodybuilding exercises or weight training exercises, because I think you can learn a lot from them. You're working on that stability, you're working on control and tempo. Those exercises will work your rotator cuff anyway. If you're training your upper body, your chest, your shoulders, your back, you will be working your rotator cuff. And if you're focused on stability, you'll be strengthening them anyway. I think if you're doing these, quite often especially this one, you're putting your shoulder into a bad position anyway, and you're shortening and lengthening muscles, and you're creating this sort of shear within your joint. So you're probably going to be irritating your tendons. This one, probably not so bad, but again, you're working those muscles by doing other things anyway. So I think there's more effective exercises than the standard rotator cuff strengthening exercises. Let me know what you think. I'm open to suggestions. I'm open to your thoughts. If you disagree with me, please tell me. It's just my opinion. I've tried to show you exercises today that are probably a bit different to what you've been shown in other videos. Take this information, what I've told you, try the exercises. If they don't cause you pain, then stick with them. If they don't feel right, don't do them. Look at other videos, see what they do, see what other exercises you like from those videos, and start building up this kind of library of exercises that work for you. At the end of the day, there's so many things that can go wrong with the shoulder that these exercises will be appropriate for some and not appropriate for others. So you need to figure out, first of all, what the shoulder problem is that you have, and then start fixing it. See a therapist first, get their advice, then get rid of your pain, then build the stability, then start building strength. With tendon problems, one thing I've noticed is that you need to be working them to some degree. The old advice was rest, it will get better on its own. But with a tendon, you really do need to be stressing those tendons. And I'm not talking about hardcore exercises. I'm talking about they need to be worked. So don't be afraid if it is a tendon to work it a little bit. Obviously, just don't overdo it. Today we're talking about rehabilitating your shoulders at home using basic weights such as dumbbells or little plates. Now these exercises should be fine for anyone with a chronic inflammation such as tendonitis, supraspinatus tendonitis or bursitis, problems that have been diagnosed and given the all clear to exercise and to strengthen. Now, if you've seen some of my previous videos, you may have heard me talk about the 3 phases of rehabilitation. So phase 1 is when you're in that acute pain. So it's only just happened. You need to get that pain level down. So that's the phase where you should not be training. That's the phase where you need to be just doing gentle movements, getting some treatment and letting that inflammation calm down. Then phase 2 is when you need to start getting that flexibility back. So that includes stretching and just general all over movements. Then we move into the phase 3 where your pain levels have gone down to maybe a 3 or 4 out of 10. So that's the phase when we can start doing this. Now, hopefully you've been given the all clear by your practitioner or by your doctor and you are able to exercise. In some of my previous videos, I talked about building stability in your shoulder. So that's one of the things we're going to focus on today, is building stability and also building strength. So in today's video, I'm going to focus on 2 exercises for stability. First is a bicep curl and second is a tricep kickback. Now I get that they are not shoulder related exercises, but if you do them properly, that will help to build stability in your shoulders. Then we're going to move on to a few other exercises. One is a lateral raise. The second is a front raise. The third is a single arm row. And then we'll also touch on external rotation as well. For these exercises, I'm going to assume that you have either a dumbbell or you've got some small weight plates. Now what I've got here is a 3 kilogram dumbbell. So this is about 6 or 7 pounds. And I've also got a plate which is 2.5 kilos, which is 5.5 pounds. Now, of course, if you don't have any dumbbells or you don't have any little plates, you can improvise. So I've got a water bottle here. You can use water bottles, you can use cans of vegetables, you can use a bag or a backpack with stuff in it to make it heavier. It doesn't matter what you use as long as you use something that's appropriate for you and what you can do. So we're going to go through the bicep curl first. First, I'll show you how to do it with the dumbbell. So what I need you to do is get your elbow into your hip. Then that doesn't move. So lock your elbow into your hip, curl the dumbbell up, pause at the top, and then slowly lower it back down. When you get to the bottom, just a small pause, curl it back up, pause, and repeat. Now, if you start to swing your elbows forwards and backwards, that means you've lost stability. So by keeping your elbow in place, you're engaging your shoulder muscles. So it's creating that stability in the shoulder. So it's building that internal strength. When you pause at the top, that shows you that you're in control. So that means when you get to the top, you're not dropping it straight down. You pause and slowly lower it down. I would recommend 10 reps. Start with 1 set and then over time build that up to 2 and then 3 sets. Now, if you're doing the bicep curl with a small plate, there's 2 ways that you can hold it. One is holding it by the end. So the technique is exactly the same, or you can hold it with your fingers through the hole. It really depends on what you find the most comfortable, but the technique is exactly the same. And of course, if you wanted, you could hold it this way, but that's a slightly different muscle, but it'll still do much the same thing. Now, the next exercise I'm going to do is a tricep kickback. Now, while this is not the best exercise for building your triceps, it's actually a really good exercise for developing that stability in your shoulder. So what you're going to do is find a chair or a coffee table or something that you can just lean on with one leg down and one knee up. So grab your weight and pull your elbow back into your side. From here, push your hand back, pause, and slowly back in. Now what you'll notice at this point here is that my hand and my elbow are not that high. and that's intentional. This is an easy setup first of all, so we're not putting too much stress through the shoulder or through the tricep. If you do find that easier, then what you can do, and the proper way to do it, is to bring your elbow higher and push your hand back further. And of course, you can do this with a plate or a can of beans, bottle of water, whatever you have accessible to you. So again, same thing, elbow back in position and push the hand back. One thing you have to make sure you do or don't do is drop your shoulder and drop your elbow. So you're doing this kind of thing here. So I would recommend 10 reps and then rest. If this is the first time you've done it, just stick to the one set. Over time, as you get better at this, you can add in a second set and then eventually a third set as well. So you're building it up to 3 sets of 10. So now we're going to start strengthening the shoulder. The first exercise I'm going to show you is a lateral raise. Now, if you have a shoulder problem such as a supraspinatus tendonitis, a bursitis, impingement, the assumption is that you can go from about here to here with relatively little pain. Once you get to about this 30-degree range and above, you will probably start to feel pain. Now, a traditional lateral raise would be all the way up to here, but we're not going to go into that. So what we're going to do is strengthen the pain-free range, and I don't want you going anywhere into pain. So your pain-free range is from about here to about here. Now, in this position I'm in now, it's relatively easy because the weight is pulling down and I only start to feel resistance when it's all the way out here. So to make that more effective, what we need is the resistance going more across the body. And the only way to get that is to be more horizontal. So I'm going to show you that now. All right, so to strengthen this range of your lateral raise, I've positioned a bench just at a slight incline. Now, obviously you might not have a bench at home, but what you probably will have is a bed. So you just prop yourself up, so a few pillows, and you're going to get yourself into a kind of a gentle incline. So what I've done here is I've put myself at an incline where my shoulder is a little bit higher than my hand. So arm straight, so weight in your hand, and just lift only a small amount, pause, and then down with control. Lift, pause, and down with control. Now, when you get to the bottom, what I want you to do is not go all the way down and switch off those muscles. So there's always going to be tension going through that shoulder. So engage your shoulder muscles just by lifting the weight slightly off of your leg and then raise only a small amount, pause, and then back down. Pause there, so there's a little bit of a gap, up and down. So it's a very small movement, but you should be in a pain-free range. Now, of course, as you start to work those muscles, you might feel a slight burning, which is fine. That's just the muscle working. But of course, if you do feel pain, then just stop. So you're going to be doing 10 reps of these and start with just one set. Over time, you can build in a second set and then a third set as well. Okay, so what we're going to do now is we're going to start working a front raise. So we're going to start strengthening the front of your shoulder. To do that, you're just going to take your arm straight out in front of you forwards. It's a bit like the lateral raise, only going that way. Now, for those of you with impingements, bursitis, supraspinatus tendonitis, that is the range that causes you problems, and a front raise should be okay. If you've got something like a biceps tendonitis, this might not be a comfortable exercise for you to do. So of course, as with the other exercises, if it causes you pain, don't do it. So I've set my bench to about 45 degree. You can use a chair, you can just scoot further forward and lean back into the chair, or you can lean up against a wall. It doesn't matter as long as you can get yourself into this kind of position. So what I'm going to do is position the dumbbell on my thigh, and then from here my arm is straight and I just lift it up to about horizontal. So my arm is about horizontal in line with my shoulder, and then down. When I see the dumbbell about to touch my thigh, that's when you stop. So there's always a little bit of a gap just there, so it keeps that tension going through your shoulder. So you're here, Lift, pause, and then down with control. Just before you touch, up, down, pause at the bottom, and up. If you let this weight come down and you switch those shoulder muscles off, you're losing tension. So you want to keep that tension all the time throughout that exercise. So you're going to do 10 reps and 1 set to begin with. Over time, as you get more familiar with this, then you can add in a 2nd set and a 3rd set. So lean back 45 degrees, arms straight, up, pause, and down, and just 10 of these. If you want to make it just a little bit harder, you can increase that angle a little bit more and just do to here. But again, you don't want to be coming up too high. So just go into that pain-free range of motion. So far now, we've done the outer part of your shoulder, we've done the front part of your shoulder, and we now need to work into the back. So although this isn't directly targeting the back of the shoulder, it will work it slightly, but it's more of a latissimus dorsi exercise. So this big muscle that comes down here. And again, it's great for stability. A strong latissimus dorsi, a strong lat muscle, will still help you with your shoulder position, with shoulder stability as well. So what you're going to do now is similar to the tricep the tricep kickback that we did earlier. You're going to set yourself up so you've got a bench or a coffee table or a chair, doesn't matter. So get yourself one knee, one hand on a chair or a coffee table, bench, whatever it is, arm down by your side, and just pull your shoulder back. So pull your shoulder blade back. And then from here, you're going to pull your elbow up, just past your hips, just past your waist even, and then slowly back down. Keep your shoulder back just for now, and then keep it coming back up, pause, and down. Now, a little tip for you on this exercise, forget what's in your hand, because as soon as you start thinking about pulling an object towards you, you're engaging your bicep muscle more. But we want to work the back muscles. So what I want you to think about is imagine there's a piece of string attached to your elbow. So someone is attached to the other end and pulling your elbow up. So this, whatever's in your hand, is relaxed. So your forearm, your hand, your wrist is relaxed. And just focus on pulling your elbow back. And when you start focusing on your elbow, you will start to feel it a little bit more in your back muscles. So if you have a slightly heavier weight, you could probably lift a bit heavier on this. If you don't, it doesn't matter. Keep it slow, keep it steady. Don't forget to pause at the top and slowly lower that weight. So keep that control. Keep trying to feel those muscles working. You're not trying to build muscle mass or anything like that. You're just trying to create more stability and more strength. So start with 10 reps, 1 set, and of course, over the coming weeks, added a 2nd set and a 3rd set as well. So now that we've done the back, we can start working the external rotator. So we can work that rotator cuff. Now, rotator cuff exercises are not generally my favorite exercises. I don't think they're that effective. But since we're at home, since we need to rehab the shoulder anyway, we can do it from home. So what you're going to do is set yourself up so that you are lying down horizontal. So for the rotator cuff, or for the external rotation, so we're going this way, outwards, your hand can start in front of your body and it can come all the way out. So it'll come from start to finish. Now, if we're doing this on our side, this first half of the range is not going to get much work. So if I'm on my side and I'm here, that doesn't really do that much. It's only when I start to get out to the most outer external rotation that I start to feel it. So what we're going to do is we're going to break it down into 2 halves. We're going to strengthen this outer range first, and then we're going to strengthen this inner range second. So to do that, you can start on your side so that your shoulder is above, so your shoulder is high and you're on your other shoulder. From here, take your hand out as far as it will go, pause and slowly back in. Pause at the bottom and all the way out, pause and slowly back in. Once you've done 10 of them, have a rest. From there, you can then turn more onto your back. Not completely on your back, but just slightly. Elbow into your side again and lift your hand up from here. So it's only a small movement and back down. Up, pause, and down. Now you'll notice that I'm only going to about here and not all the way out to here. So you're going to strengthen this range here. So you're on your side first. Then you're going to turn more onto your back and strengthen this range here. So aim for 3 sets of 10 in total eventually. You don't have to do the full 10 of one range and a full 10 of the other. You could do 5 of that outer part first and then 5 of that initial phase second. So that would be 10 reps in total. You can make that one set and you can build a second set and then a third set from there. So far today, I've shown you 2 exercises for stability of your shoulder. We've got the bicep curl and we've got the tricep kickback. While they're not directly working your shoulder muscles, if you're keeping your elbow in place, they are developing stability. So they're really good exercises for you to start with, especially if you're on your initial phase of your rehab plan. From there, we went into doing a lateral raise, then a front raise, single arm row, and lastly, external rotation. I would suggest just start with 1 set of 10 of each exercise first. Then over the coming weeks, you can add in a second set and then a third set. Now, in terms of frequency, I would suggest do it every other day. So you're doing 3 to 4 of these workouts a week, but definitely do not do it every day. Because if you're doing it every day, you're not allowing your muscles to recover. So you need a day off in between each workout so that your shoulder muscles can get stronger. And of course, if you are feeling any pain, if you're feeling any discomfort doing any of these exercises, then just don't do them. You can expect this phase, this rehab phase, this strengthening phase, to take around 3 to 4 months to start seeing some results. So be patient with it, guys, and be consistent. If you have any questions, do stick them in the comment section below. I do read every single one of your questions, and of course, I do appreciate every comment that you make.